Now, on assumption of office, the Coordinating Minister of Health and Social Welfare, Dr. Mohammed Ali Patti, declared a state of emergency in the health sector, citing poor condition of health facilities, and took steps to salvage the sector. Remember, I told you we're looking at Nigeria's health sector today. He thereafter, in consultation with states, the private sector, and development partners, articulated a 4-point agenda that aligns with the president's overall reform agenda. That's the Renewed Hope agenda. The agenda, which aims to save lives, reduce physical and financial pains, promote health, and ensure it is accessible to Nigerians, was built on 4 pillars. These pillars are improving the governance of the health sector, improving population health outcomes, unlocking the healthcare value chain and health security, and then disease emergencies. One of the notable initiatives taken by the federal government to implement this agenda was signing of a strategic compact with the 36 states and the FCT, endorsed by President Tinubu during the unveiling of the Health Sector Renewal Investment Initiative last year. This pact aims to mobilize $2.5 billion between 2024 and 2026 to revamp primary healthcare infrastructure, retrain frontline health workers, improve medical equipment, ensure accountability and prudent utilization of resources for an efficient primary healthcare delivery system. The redesign of the Basic Healthcare Provision Fund was another major policy in the sector to improve the operations of the primary health system, Nigeria Center for Disease Control, NCDC, and the National Health Insurance Authority, NHIA. And as a follow-up, the federal government earmarked about 50 billion naira to strengthen primary healthcare delivery, NCDC, and NHIA across the states. Over half of this amount has already been disbursed to the states. Other significant initiatives of the federal government are expansion of fully functional primary healthcare centers, PHCs, from 8,809 to 17,618 by 2027, and ensuring better service delivery across the nation. Now, some of the notable achievements of the federal government being implemented include refurbishing and equipping of over 1,400 primary healthcare centers. Expansion of health insurance coverage as over 2 million more Nigerians were enrolled into the National Health Insurance Scheme this year, and over 2,400 medical professionals were recruited to address workforce challenges or shortages. In the area of vaccination, over 5 million girls in 14 states and the Federal Capital Territory that received the HPV vaccine, that's human papilloma virus, to reduce cervical cancer incidents, while NCDC responds to disease outbreaks such as diphtheria, mpox, Lassa fever, cholera have been top-notch, with constitution of emergency task force. And in furtherance of efforts to reposition the health sector, the Federal Ministry of Health and Social Welfare today begins a stakeholders meeting tagged 2024 Nigeria Health Sector Wide Joint Annual Review, JAR. This is with a view to rejig performance and highlight achievements recorded under its newly operationalized sector-wide approach. Well, from the introduction, most of you will have guessed who our guest is this morning, and our conversation, of course, will be health-centered. And who better to tell us about developments, achievements, and challenges than who wears the cap? The Minister of Health and Social Welfare, Professor Mohammed Ali Patti, who is the House on Politics nationwide. Welcome to the program.
Thank you for having me.
So let's begin. When you assume duty, you hit the ground running, and we've talked about some of the things already happening. How do you ensure that these reforms become realities to Nigerians, and then they don't end up as shelves or in shelves in offices, and as is usually the case? We just talk.
Yes, I think there are some fundamental truisms that we have to understand. That health is inherently valuable to each and every one of the 230 million estimated Nigerians. It's also a right. It's a driver of human capital, and it is a cause and consequence of economic development. So for the vision of the president of a prosperous, peaceful Nigeria, health and well-being of the Nigerian person, whether a woman or a child, is so important. And in our country, which is challenged with multiple fractures and divisions, health is one element that the president is keen to use to heal and unify this country, because it affects everyone across political spectrum, across geographies, across wealth income, disparities. All of those divisions disappear when it comes to the health of the Nigerian person. That's why the reform agenda that was articulated under the leadership of the president tries to improve the overall health and well-being of Nigerians, and to do it for all Nigerians so that no one is left behind. The poor, the rich, women, girls, elderly, youth, everyone to get it. So it is all of us collectively that will co-create the healthier Nigeria that we want to see. And the goal that we articulated to save lives is very evident: to reduce physical and financial pain, and to produce health, because we can prevent diseases before they occur. We can promote health. And to do it for all Nigerians is the goal that we set. And the agenda that we articulated was one that was done in a consultative manner with states, with local governments, with civil society organizations, with the private sector, to determine our own national priorities, and then our external development partners to see how they can align behind those priorities under the leadership of government. And that is the agenda that we put in. The first pillar that you mentioned on governance, it's so vital. It's not a technical issue. It's really bringing multiple voices in an inclusive manner to set priority. And we set the compact with the state governments, and the local governments and Algon have indicated they would like to join within that, given the prevailing circumstances that we have. Development partners join and sign this compact, which says expectations clearly. What can we expect? What can each level expect? And what are we committing to, including our development partners? And to mobilize resources and allocate them, because there are many priorities in Nigeria, but should we prioritize health? The president increased the allocation to health sector, and we called on state governments to also prioritize health spending as well. And to improve the transparency and accountability within the sector, so that we have our dialogue in open manner around the table. And you may have seen the Basic Healthcare Provision Fund redesign, which is open on a quarterly basis, with media, with civil society engaging, and many other fora. And to have matrices to help us hold each other accountable. Without matrices, without measurement, how can you hold someone accountable? One can always find an excuse with one story or the other. But you need to have facts to be able to say, here's how we're making progress, or here's how we're not making progress, and you answer to that and have consequences for it. And to reorient ourselves to respond to the citizens' needs, so that it's not a group of folks that are sitting in Abuja determining what happens, let's say, in Ilela in Sokoto State, but that we take a pulse of what the Nigerian person is experiencing, and for government to respond, because the principal is a Nigerian person. The government is the agent. His Excellency President Tinubu is a progressive leader. He wants government to respond to the people's needs. And that's why in 2023, as part of the design of this set of reforms, we had a People's Voices survey, which for the first time looked at 2,500 Nigerians. They were interviewed from all 36 states to understand what's the perception, what's their experience, what are their expectations, what are they suffering from. And all of those connected with these pillars, and they are part of the governance pillar of our agenda. Now, the other three pillars, the one on population health outcomes, that one is really directly things that would improve the health and well-being of Nigerians through the health system, but also in a multi-sectoral way. Because for the health sector, we see our clients, not only the ones who are sick in the hospitals. We are not the Ministry of Disease or Ministry of Sickness. We are Ministry of Health. The entire population of Nigeria is our client. Now, the majority of Nigerians are generally healthy. Either they are fully healthy or they are sick without knowing that they are sick. Only a small fraction are febrile, have this disease or that disease, and we need to take care of them. So health promotion, disease prevention is also an element, so that we prevent diseases from happening. So last week, for instance, we had a health promotion day, the first ever, where we the state governments, we're trying to get all adults to screen themselves: hypertension, know your numbers; diabetes, know your sugar level; cholesterol, and try to control them. Because by doing so, we're producing health. This is the health production side, or dealing with nutritional challenges, dealing with water and sanitation, dealing with other issues of hygiene, stopping of open defecation. And then what we do in the health sector for those who are sick, from vaccination through primary healthcare centers to improving antenatal care for women, contraceptive for women who need it, safe delivery, and referral systems, and revamping the primary healthcare system, which you had mentioned in your opening. And then for those who are referred to higher levels, the secondary facilities are in the realm of the state. The tertiary hospitals are the primary responsibility of the federal government. And with those, we have expanded. The president approved 16 major infrastructural upgrades, 6 cancer infrastructure and equipment upgrades that are already underway, funded. 2 of them will be ready by May 2025, and the rest will follow. And 10 other infrastructural engagements, 8 diagnostic centers through NHIA and 2, and human resources.
Okay.
So that is the second pillar, as well as expanding insurance. The third pillar is for us to produce what we need to use, from basic commodities, test kits, and all of that. And the fourth one is to tackle outbreaks to enhance health security, from diphtheria, which we controlled, to meningitis, to cholera, to mpox, and also even diseases that are yet to manifest, to be ready to be able to respond.
Okay, quite a lot, but we'll take them bit by bit. Now, I will start with primary healthcare centers. And you announced 50 billion of the basic healthcare provision fund to be channeled to primary healthcare centers, NCDC and NHIE. Over half this amount has already been released to the states. Now, you talked about the fact that you did a People Voices survey, basically a needs assessment of what people need. You have had meetings with states. The local government system is interested through ALGON. From the disburse of the funds you've already released, would you say there have been remarkable improvement? What exactly has happened in the primary healthcare centers? Let me even take it up to the NHIA, National Health Insurance Authority. As we speak, somebody says she went to the hospital and a drug as simple or as easy as paracetamol is not covered under NHIA. So what exactly are the stories?
So you mentioned more than 50% of the 50 billion.
Yeah.
Actually, it's much more than that, that have already been released through the Basic Healthcare Provision Fund. For the first time, that mechanism has been revamped, and there was a very rigorous audit across all the 36 states of the Federation to ensure the funds, we understand how they've been utilized in the past, and remediation by all the states, and a contract that they signed with us in terms of the use of the resources. So we are fairly confident that the flow of funds to the front lines through the BHCPF has improved through the various gateways, and we disperse this openly. We ask ICPC, EFCC, other entities in government to track, and also encourage communities to let us know if there are evidence of diversion of those resources. Now, the reality is that the thousands of facilities that are reached by direct facility financing through the BHCPF that have received those funds, they are able to get their health workers in place, provide them with stipend, buy the essential commodities that they need, keep their facilities in good shape, as well as through the NHIA, through the Vulnerable Groups Fund that has now been expanded so that more enrollees are covered through the NHIA to be able to afford services, because the cost of accessing services can be a barrier, particularly for the poorest and most vulnerable. And we added on the back of that an effort through NHIA to provide coverage for women who have obstetric fistula, so that they get repairs at no cost to them, because these are really women who have unfortunate complications of pregnancy and they tend to be outcasted. And we're expanding it now to also provide access to comprehensive emergency obstetric services for women who need it, such as cesarean section, as part of the effort to reduce maternal mortality, because there are many women who may lose their lives because they're not able to afford cesarean section. Now, there are other windows in the BHCPF. One is the NCDC window, which is really around health security. So when we had the cholera outbreak or the meningitis outbreak, to investigate those, NCDC uses some of the meager resources allocated through the BHCPF to activate, to work with the states for that. And then the Emergency Medical Treatment Committee, the NEMSA scheme, the Emergency Ambulance Services Scheme, which has provided ambulances, but also pays for cost of transporting pregnant women from their homes to facilities, is also through that window. You asked what has happened.
Yes.
The people,
because I'd like to add, because have we seen a reversal of people moving from their communities just because of malaria to the teaching hospital? Have we seen the crowds at the teaching hospital reduced?
So I think there are two facets that I would like to respond to.
Yes.
First, at the macro level, we did the People's Voices Survey in 2023, and we did another one in 2024, because the only way, rather than going to 1,000 facilities and hearing stories, you use a survey instrument that samples and interviews the perception of Nigerians overall. And so we have at least the story of the last 12 months in terms of perception of Nigerians. And what the People's Voices survey shows is that about half of Nigerians are confident in the competency of the Nigerian health system to respond to emergencies. That is good, but it also shows that we have a lot more work to do. We also have seen through that utilization of services in the last 12 months among surveys respondents has increased. 15% in many instances increase in checks for diabetes, for hypertension. We've seen increases in cancer screening, but we've seen a dip, for instance, in mammogram. Women that are going for mammogram. That's an important indicator. That survey also asked perception around the quality of what Nigerians are experiencing in the health system. It is not asking those who are in the hospital, but generally of those who've been to facilities, what there is a perception of quality. And generally, the quality is good. It's better in the private facility, that's the impression. When you ask them the quality of the workforce, the time that they wait, their experience in the facility, and the overall perception. So we have matrices to check on that. So that's on the instrument that we have used. But if you ask at the each individual facility, I do believe that the data that we're seeing is that antenatal care is increasing. We still have a long way to go in terms of women going back to deliver, because there may be other barriers, for instance, education, cultural barriers, just understanding, trust, because for years, those facilities have not functioned. And we are working with the states and local governments, and they vary in the degree to which they are connecting and pulling their weight. Some are doing very well, and some are still organizing to get to that.
Now, people listening to you say, because you said part of the survey showed that Nigerians seem to be more confident with the health care they receive. People listening to you will ask you one fundamental question. Honorable Minister, why is it that our leaders, for instance, still believe in going out for medical treatment?
An excellent
and spending so much money.
Yes.
And are being criticized on a daily. In fact, let's even start from our president.
Yes.
He wants to go for medical treatment, he goes abroad. And you hear Nigerians saying, how come? If we're more confident in our system, why is it that our leaders, who are supposed to be the rallying points to make us, show us that confidence, are the ones jetting out for treatment?
I think fundamentally there's a population perspective. When you look at 220 million Nigerians don't go abroad for medical care. The fraction is a very tiny fraction. But when you talk about medical tourism, there are many reasons why people travel abroad. Some travel for religious tourism, some for education tourism, some for conference tourism, and some for health tourism. And it's a phenomenon that is global. It's not limited to Nigeria. There are folks who come to Nigeria for medical care. Let me tell you, Maiduguri Teaching Hospital is a hospital that had one of the best cancer centers until the flood devastated it recently. There were patients from 6 countries in the region that were coming to that facility for cancer care. Is that bad? because others come to Nigeria for medical care. There are others that go to Lagos. We have a world-class cancer center in Luth, as well as private facilities that they come for care, including leaders from other countries. Is that bad? There are folks leaving the United States and going to East Asia and Pacific for knee replacement. People live in the United Kingdom, where the waiting time is long, come to Africa and, in fact, come to Nigeria for medical care because it's faster. So you have to look at it as a system and also the population level. The choice that individuals make can come from different reasons, so long as it's their private resources that they use. And there are reasons such as privacy, such as long history, because even before coming to office, they may have been used and their records and their investigations are in one place, or even their privacy. So let's not focus on just individual cases. What we're interested in is the health system overall and the population, to make sure that if you want to have health care and you can choose a place in Nigeria to afford it, to do it at the quality that is needed, and that the poorest and most vulnerable, you're talking about people traveling abroad. There are people who struggle to pay for cesarean section, to pay for antimicrobials or antibiotics if they have infection. So why are we not talking about them? We're focusing on those at the bottom of the pyramid to ensure they have access to the most basic healthcare services. And if those at the tippy top, the wealthier Nigerians, let's have the private facilities, if they are in place, that they pay for them. Because when they go abroad, they pay not free. They don't go to government hospitals in the UK or in other places. Okay. So how do we revive even the private sector in Nigeria so that it caters to them? And that is the third pillar of the president's agenda.
Okay. If you walk down to, we have Gariki Hospital just here now.
Yes.
Now, if you go there now, you will see crowds of people, a crowd of people waiting.
Yes.
The question you'd ask yourself is, in fact, you might even be discouraged as a patient because you're wondering from the time you get your card to the time you see the doctor, how long it will take you. You're already, there's this apprehension of wanting to even sit to wait for a doctor. And that brings us to infrastructure. There was a time, I'll use myself as an example. I went to FMC Jabi here. I'm calling names so that
yes, no, absolutely.
And light went off. And
yes.
we were waiting to get, everything is computerized. To get you pay when you go for some certain clinics to get your file out and all that. No lights. We had to wait for almost an hour for the generators to come on. Then that alone is a discouragement, because perhaps if I'm working, I need to come to work. I need to do what I want to do to come to work. Then another thing is the attitude of the health workers. When it happens, some of them don't even talk to you politely to wait. They couldn't care less. So that's another thing. Let's look at attitude of the health workers, infrastructure, and do you think that people believe in the skills that our doctors have, in terms of giving proper diagnosis and treatment?
Yes. I think there are multiple levels. The questions that you've asked. First, as Nigerians, we have to believe in this country and that we collectively will make it work. And the issues of health sector are peculiar, but in some respect they are connected with other challenges that we face as a country, which are emerging, which will go through and will grow and build this country to be prosperous in the future. But it requires hard work and sacrifice, as the president said, by all of us. When you compare the expectations of elites like you who have traveled abroad, have experienced NHS, the UK and all of those, you don't compare how much does the UK, for instance, spend on its health system. It's £4,000 a person. How much is the total health spend per person in Nigeria? It's in maybe $100 per person per year. The public side of it is much smaller. So the prioritization on investment in health has not been very prominent in our polity for a long time. For many years, we have underinvested in the infrastructure, the human resource, and the equipment. And in the last 1 year, this president has prioritized it to begin to change the direction. That's why he's increased the health budget. That's why he's expanding the infrastructure in many facilities. And that's why we're asking states. In the case of Gariki Hospital, it's a hospital under FCT. So the FCT also invests more, and it is trying to do more. His Excellency Minister Wike has really doubled up in terms of investing in the infrastructure, in terms of medical palliatives and other things. But that is playing catch up because there's a multi-year deficit that we're trying to fix. But with what we are already spending, how do we allocate it? Should we allocate it to serve those who already have, or should we focus on the priorities for everyone? Immunization, pregnant women, primary health care. How many folks, like you will go to a public primary facility, but there are many Nigerians in rural areas, whether in Lagos, whether in Akwa Ibom, whether in Maiduguri, that have nothing. And the simple thing that they expect is to protect their child against measles. Are those vaccines available? So that's the trade-off. Now, as we embark on this massive infrastructure, I talked about 16 major infrastructure projects. When we finish this 6 cancer infrastructure and equipment, Nigeria has never had that level of massive investment in cancer infrastructure and equipment. That means folks that travel to Egypt, to India with the unfortunate diagnosis of cancer can be treated here. They save money and our providers take care of them. The attitude of health workers, yes, like most things. If I talk to other sectors, if you fly, if you go to hotels, my goodness, even on the streets, you can complain about one or two. But the Nigerian health worker, it's really someone that we should celebrate. Because I have seen health workers in rural areas working in difficult circumstances, but still continuing to serve their population. Because no one, whether a doctor, nurse, works and wakes up in the morning and goes to over and say, I want to make somebody sick, or I want to make somebody miserable. But they have tons of workload in front of them, and they are facing multiple constraints which we cannot ignore. So we appreciate them. But to ensure that they improve in terms of the interpersonal, there are various efforts on the way to improve interpersonal engagement. For frontline health workers, when the president came, we said we would have 120,000 health workers retrained over 3 years. And by now, we have retrained 40,000 of them. The training modules were revised. It was an integrated curriculum and included elements that will help them even engage with their clients better. Because sometimes you don't know what they're going through, but there are mechanisms to improve the management of the health facilities.
Can you boast that under this administration, we've had less capital flight of our doctors, nurses, and even our paramedicals, and maybe even less strikes by our doctors? Because I know every now and then, for instance, the National Association of Resident Doctors in states will embark on strikes. People will be stranded in hospitals begging them to return. What is the administration doing to prevent this attitude of our workers wanting greener pastures outside?
Yes. So in the last year and a half of this president, I think we have enjoyed relative stability in the sector. And the reason is because I think the president cares about this issue. He cares about the health workers. He met with resident doctors, professional groups that had issues. They come to us. We have an open door. We have tried to set up a very respectful relationship. We've tried to earn the trust of health professionals, to have dialogue with them, and where issues arise, we rectify. If we've made mistake, we try to correct ourselves. And that openness and that idea that we put the Nigerian person at the center, not ourselves. It's first order thinking to think, what do I need? And I'm not getting what I need, so let's blow it up. Versus to say, what does a society need? What does a Nigerian person need? And why should strike be the last option? Because when you go on a strike as a health professional, it's not some other profession. Lives are lost. Pregnant women don't get catered for. Accident victims don't get served. So who wins? Nobody wins. And I think the Nigerian health workers, various unions, understand that. And they've worked with us. And we don't take that for granted. And the issues that they had in the past bedeviled this arena have been long-standing issues, but we're gradually making progress in trying to resolve them. At the end of the day, a better health system and better health for Nigerians requires all of us to work constructively, to put the Nigerian person at the center, to unite ourselves. If there's one area that we should not have much discord, it's health. It's not some other sector where you can take one position or the other. It's not necessarily only a political issue. So in that sense, we've seen stability and we're not taking it for granted, and we'll continue to work to resolve issues as they arise and to listen, to agree, and sometimes to disagree, and to agree to disagree. So that is something that we will continue to pursue.
One mover and shaker is the Minister of Health and Social Welfare, Professor Ali Pate. He's our guest on Politics Nationwide today, and we're looking at challenges, successes, and what to expect to see in our health sector in the near future. It's time for you to make your contributions, ask questions, and perhaps things bothering you. You can talk to us via the numbers 091 509 10482 or 091 509 10483. 091 509 10482 or 091 509 10483. Remember, no name calling, no abusive language. Stick to the topic and go straight to the point. 60 seconds it is. Our first caller, I think, is here. Hello, good morning. Hello. Hello, good morning. Hello. Hello, good morning. Okay, there might be a network issue. I'll take the lines again. 091 509 10482 or 091 509 10483. Now, while we're okay, hello, good morning. Hello. Hello. Okay, while we wait for more calls, let's continue to what we're talking about. Let's look at you're having a meeting tomorrow, and that's the 2024 Nigeria Health Sector Annual Review. And you talked about it when you started, where you meet with 36 state commissions for health donors and development partners. What do you intend to achieve through this meeting?
So it's an opportunity for us to take stock of the progress we've begun to make. We have two important reports that are coming out. The DHS, which is the outcome of a survey done in late 2023, that looked at the population health. It's one of those things that happens every 5 years. 46,000 households were interviewed, which will show some progress in reducing child mortality, some improvement, slight improvement in infant mortality, and the issue of neonatal mortality that has continued to persist, and that we have improvements.
Sorry to interrupt you. I think we have a call. Hello, good morning. The line is noisy. Hello, good morning. We might not be able to continue. Go on, sir.
And that we have reductions in things like diarrheal diseases, lower respiratory infections. It will also show improvement in contraceptive use in 21 states, and 6 states, for instance, have doubled their use of modern contraceptives. For instance, Imo, Ogun, Nasarawa, Gombe, Akwa Ibom, for instance. So it's positive, but there are also challenges in terms of the cost of care, cost of that increase in access. The second is the People's Perception Survey that I mentioned, which is showing that, in fact, it's still work in progress. We are making progress. Nigerians are increasingly confident and the utilization is increasing, but there are challenges in terms of cost of accessing care and the need to continue to build on the momentum on expanding insurance. We'll see that 2.4 million Nigerians have had public insurance and the private insurances remain flat, which puts pressure on us and NHIA to reform the insurance program, particularly to increase enrollment in the private side. So that's the base of this discussion.
Okay. I think we have a caller now. Sorry. Hello, good morning. Hello. Your name and where you're calling from? Go on, Adam West.
Good morning.
Okay, Adam West, you've made your point. You've exhausted your 1 minute. Hello, good morning. Do we have another caller? Hello. Hello, good morning. Eh, Okay, Iswago Ibrahim, you're welcome. Yes.
Good morning.
Okay, thank you. Thank you, Iswagwe. Thank you. Thank you, Iswagwe Ibrahim. Another caller. Hello, good morning. Hello. Okay, not call yet. So, Dr. Pate, I know you were jotting, so it's good for makes it easy for me. I don't need to go through the questions again. I'd like your responses to.
No, thank
two.
you.
Yes.
Thanks to the callers. I think they both made excellent points. Establishing key facilities in each of the geopolitical zones, expanding infrastructure is exactly what we need to do and what we have started. I mentioned the 16 major infrastructural projects, and there's several across many teaching hospitals. We're establishing federal tertiary facilities, revamping the infrastructure for cancer, for other diagnostics, working with NSIA, including world-class equipment. Unfortunately, I mentioned the University of Maiduguri. There are others, Namdi Azikiwe University Teaching Hospital in Newi, for instance, Lagos University Teaching Hospital. They are doing amazing things, but sometimes people are not aware, so they go abroad for care that they could have received here at a much lower cost. Sometimes it's a status symbol. Sometimes people, for various reasons, travel. But we are working on that, and I thank you for those comments. And we will continue. We're just beginning under this president. I think he's got a few more years ahead to continue to build on this. The point by Isago Ibrahim is also a valid one. The whole point of integrating between federal government states. That's why, for the first time, there is a compact signed between the federal government and all the 36 states. Imagine all this while we didn't have any compact that governed how states and federal government related. Now we have a signed agreement witnessed by the president, and that local governments are also included. That means that we should bring up the synergy. The federal government invests more, the state should invest more. When we say the goal is to produce and improve the health of all Nigerians, wherever you are in this country, your health matters to Nigeria because you are a human being, you have a right to it. It's also something that builds our country to get to where it needs to be in terms of a productive country, productive nation. But he also mentioned that a lot of money is being invested. Yes, there are investments that have been made, but I want to point out that Nigeria has not invested as much as it should overall. Good healthcare is not cheap. It costs money. Take vaccines, which we use to prevent diseases. Federal government puts at least 80, 90 million US dollars a year to co-finance the vaccines that are provided to everyone for free. People receive it for free, but they sometimes don't think that it costs money, even if there are other partners that co-finance, contribute. So these are expensive interventions, but we need to do more. Yeah.
I'm happy you're mentioning that because I saw an article where Nigeria's Vice President Kashim Shettima, he was, doing a groundbreaking or grand opening of a private hospital. The name wouldn't be mentioned because that would be free advert. But he said in that grand opening that our health sector has attracted over $4.8 billion in potential investments, and he attributed that to the reforms under this administration. What is it about?
So the third pillar of the President's reform agenda in health is to unlock the healthcare value chain, because there's a whole value chain as well. We produce either the products, commodities, or even the services here. There are investors that are trying to establish plants to manufacture pharmaceuticals. There are local manufacturers that are expanding their investments. There are those that want to produce test kits. In fact, there is a major manufacturer of medical equipment that is coming to set up a plant to assemble some of those here. And then there are the private sector investors who are building hospitals. And in Lagos, in Abuja, and a few other places, they will provide services. Because when people travel abroad, they don't go to public facilities, they go to private facilities. So why can't they stay here and keep that economic value? And we're seeing Nigerians abroad coming back to Nigeria to set up private facilities.
Yes, okay.
Dr. Julius Oni in Lagos is a case in point, a world-class orthopedic surgeon, leaving the United States, coming back to his home country to establish a world-class orthopedic center. So there are many of those, and
well,
there is a lot more.
investing. Okay.
Yes,
Go on, because we have a caller on the line, but let me allow you land. Yes.
So health, it's a major component of many countries' GDP. In Nigeria, we can invest in health, and governments need to do more, and federal government is pulling its weight, and we know some states are doing so, and the private sector also has a role to play. I
hope they are not investing at the detriment of the government hospital. Because what Nigerians complain of, they refer you to their own hospitals and charge you more.
The public mission is primary. From government, we are stewards of a mixed health system that comprises public, which shall be for everyone.
Okay, thank you, Ada. Thank you. I think Prof has already answered some of the issues, except if he wants to expand, because I was going to ask my next question, and that is the fact that, well, let's take another caller. I see my producer giving me signals. Hello, good morning.
Hello, good morning.
Yes, your name and where you're from. Yes, you're welcome.
My name is Chief
Yes.
We need to give more attention to our temporary health sector. If you go to most of the rural areas, the majority of the areas is roadside. They don't have access to medical facilities. Where the primary health center facilities exist, they are not equipped. You don't even have nurses and doctors who attend to them. Pregnant women in rural areas trek up to 10 kilometers to look for where to deliver. Let me also suggest that health departments of our various local government areas in the town should be the information who will carry out health activities if they are painful. Let them have sanitary people, let them have those that are health educators, so that they will go there and educate Nigerians on health issues at the rural area.
Okay.
Thank you.
Thank you, Chief Fidel. I know you've also talked about primary healthcare centers, but as I said, you might want to make some more expansion. Go on.
I cannot agree more with Chief from Owerri. PHC is the foundation, and it requires local governments to step up, states to step up, to supervise, to provide resources, and federal government to support. And federal government is doing a lot through the Basic Healthcare Provision Fund in all the 36 states. But primary responsibility in terms of local governments and states, I cannot sit in Abuja and determine, let's say, what happens in one particular local government. In the fiscal federalism that we operate, we all have to pull together. And the first time that we now have a compact with primary healthcare revival as one of the key elements in that is the right direction, but we need to do more in terms of the health workers being present, the commodities being present, the accountability, the community engagement, that the community leaders actually own it, because we have to produce. And there are things that go outside the health facility that happens in our own homes how we feed our children, breastfeeding, how we take care of our pregnant women, how we encourage them to have antenatal care. When they come to deliver, we don't allow them to deliver at home and bleed, to clean our environment, deal with open defecation. It's not government that does that, but it's part of what we need to do to produce health.
Now, even Chief Fidel talked about the issue I'm going to raise next, and that's the cost of drugs. Now, import duties were placed on pharmaceuticals and health commodities last year. It was suspended this year, yet the prices of drugs are at the rooftops. In fact, I was discussing with my colleague yesterday, and I said even the basic malaria drug, I don't want to mention the name or the product, has gone up to, the one people use most has gone up to almost 6,000 naira. And you know the kind of economy we're operating on there. So a lot of people cannot afford drugs, pharmaceutical products. It's high, still it's just soaring, skyrocketing. So why do we still have our drugs and commodities that high?
The big question, I mean, this is a big question for Nigeria. There are many elements. Take crude oil, we produce it, but until recently we didn't refine it. We depended on imports. And now, where are we? So there are many questions in terms of deindustrialization that this administration is trying to change. And in health, that's why we said, let's begin to produce some of those commodities domestically. Because we were importing more than 70% of our generic pharmaceuticals, 99% of our devices. We're just open to people who are importing. We're importers from everywhere, but we don't produce anything.
Some
and yet
people
we're a
say
large
it's
country.
dumping ground.
Yes, so that's why the president had this initiative to unlock the value chain. And he took a very bold step in the executive order that he signed to reduce import duty tariffs on raw materials and equipment for manufacturing of health commodities, and also to allow organizing the demand to support local manufacturers. That's just one element. The medical relief program, for instance, that he approved to enable pool purchase of commodities for those who can afford it. Of course, it's not enough, and it's only the federal government, and states have their own drug management agencies and our own mechanisms, revolving funds that are helping to alleviate the cost for Nigerians. And then expanding insurance. 2.4 million Nigerians are now covered through the VGF, and it's not enough. We're not nearly enough where we should be, but in terms of direction, that's the direction of travel. So that the cost of care is covered for Nigerians. It is us collectively working to produce, but also government intervening, particularly for the poorest. Now, for someone like you who is in Abuja, who is fairly well-to-do, you probably don't need the subsidy. But for this, for my cousin who is in the rural area in Bauchi, for instance, he would need that relief that government is trying to do. So that it's targeted at the poorest and most vulnerable, and we collectively be our brothers' keepers in that way.
Okay, let's look at vaccines. For instance, there's a malaria vaccine. Are we seeing the end of malaria in the country through that vaccine?
Well, the malaria vaccine is an exciting development. It's one more tool in our toolbox to deal with malaria. There are many countries in the world that were able to eliminate malaria without using the vaccine, but using existing tools. What we discovered is that the tools that we had not been optimally deployed. For the last several years, we've just controlled it, just 5% reduction. Of course, there's a challenge of climate change and how the malaria parasite and the ecology of the mosquitoes is changing because of the rainfall patterns that are changing. But this tool that has come up is one more, but it is not enough by itself. It's not a silver bullet. It has to be laid on the back of treated bed nets, seasonal chemoprophylaxis for children, so that children get these drugs twice a year, intermittent therapy for pregnant women, very good case management, testing and also treatment with quality drugs that is affordable, so that folks don't take medicines that are not really working. And that's what the regulator, NAFDAC in our instance, has to do more in terms of ensuring that quality and the distribution of those. And the vaccine, which is given at children at this moment, it's a vaccine that requires multiple doses. It also costs money, and so we are being thoughtful in how we introduce it.
A lot of Nigerians have come to discover that our drugs, we're becoming very resistant to our drugs. And a lot of drugs don't seem to be working well. And they have attributed it to bad nutrition, this issue of GMOs, we're taking a lot of chemicals into our system and all that. What's your advice to Nigerians and even those in the health sector in terms of drug usage and to ensure that we have potency of our drugs?
The first pillar of our agenda is to strengthen governance, and regulatory capacity is a key part of that. NAFDAC is an agency of the federal government that we're working to strengthen so that it controls importation of fake substandard medications, counterfeit drugs, and other commodities. But they also have to work with others in our ports and to improve the surveillance and the distribution system. We have created coordinated warehouses, closed open drop markets, let's say in Kano, and very soon in Idumota and Lagos will also be closed so that we reduce the entry of these kinds of substandard medications into our system. That is important to protect the safety, maintain the efficacy of what people drink. It's much lower now than it used to be, barely 10, 11%. I think that it's not as prevalent as people think. There have been some improvements, but it's not enough. We cannot afford that, particularly if we want to industrialize, because those who manufacture here want to be guaranteed that a counterfeit will not come in and take the market away from them. That's one part. In terms of the overall exposure, we're seeing rise in non-communicable diseases, hypertension, diabetes, cancers. There are many elements that folks get exposed to: pesticides, other heavy metals. We're looking at the regulatory framework overall to see what gaps exist and how can we protect the health of Nigerians from risks that may be in the environment. There are other aspects of government, environmental health risks that are being regulated, so other places, but we are looking, we're reviewing that, and to do that in an inclusive manner, not to duplicate, not to take away any entity's functions, but to see how do we safeguard the health and well-being of Nigerians.
Thank you very much. A good place to leave it. I'm sure we'll talk more because the health sector is quite wide. But I'd like to thank you very much, Minister of Health and Social Welfare, Professor Mohammed Ali Patti, for stimulating our conversation on the health sector this morning.
Thank you very much for having me. Thank you.
That's it on Politics Nationwide today.